The thyroid gland, that butterfly-shaped organ in your neck, regulates metabolism throughout your body. Its hormones affect heart rate, blood pressure, cholesterol metabolism, vascular function, essentially everything cardiovascular. Thyroid dysfunction, particularly hypothyroidism or underactive thyroid, affects roughly 5% of the general population, with rates much higher in women over 40. Many cases remain undiagnosed for years because symptoms develop gradually and can be attributed to aging, stress, or other conditions. Winter exposure may unmask subclinical thyroid dysfunction by stressing an already compromised metabolic system, creating cardiovascular vulnerability that deserves more attention than it currently receives. Thyroid hormones are essential for thermogenesis, heat generation. When thyroid function is low, your basal metabolic rate drops, you produce less heat. This means compensatory mechanisms kick in to maintain core temperature during cold exposure. Vasoconstriction becomes more pronounced and sustained. Shivering, which generates heat through muscle activity, may be inadequate if metabolism is impaired. The result is that someone with hypothyroidism experiences more pronounced and prolonged vascular responses to cold than someone with normal thyroid function. These vascular responses have direct cardiovascular consequences. Sustained vasoconstriction elevates blood pressure. People with untreated hypothyroidism often have elevated blood pressure as a direct result of their thyroid condition. Add winter cold exposure and blood pressure can reach dangerous levels. Thyroid hormones also directly affect heart muscle contractility and heart rate. Low thyroid function can cause bradycardia, slow heart rate, which might seem protective but actually reduces cardiac output and the heart's ability to respond to stress. The lipid effects of hypothyroidism are particularly concerning for cardiovascular risk. Low thyroid function elevates LDL cholesterol, the harmful variety, and raises triglycerides. It also increases homocysteine, an amino acid that damages blood vessel walls. These lipid abnormalities accelerate atherosclerosis. Someone with years of undiagnosed hypothyroidism may have developed substantial plaque burden that becomes symptomatic only when winter cold stresses the cardiovascular system. Autoimmune thyroid disease, particularly Hashimoto's thyroiditis, adds inflammatory components to cardiovascular risk. The autoimmune process creates systemic inflammation with elevated inflammatory markers that destabilize atherosclerotic plaques. This inflammation may worsen seasonally, though the mechanisms for seasonal variation in autoimmune activity aren't fully understood. Subclinical hypothyroidism, where TSH thyroid-stimulating hormone is elevated but thyroid hormones remain in the normal range, represents a gray area in medicine. Many people with subclinical hypothyroidism have no symptoms, but cardiovascular effects may still occur. Winter's metabolic demands might push subclinical disease into symptomatic territory or unmask cardiovascular vulnerability that wasn't apparent during less stressful seasons. Diagnosis requires blood testing, primarily TSH and free T4 thyroid hormone levels. The challenge is knowing when to test. Symptoms of hypothyroidism, fatigue, weight gain, cold intolerance, dry skin, constipation, depression, these overlap with many other conditions and with normal responses to winter. A reasonable approach is screening for anyone with unexplained cardiovascular symptoms, especially if accompanied by any suggestive symptoms or in populations at higher risk: women over 40, those with family history of thyroid disease, people with other autoimmune conditions. Treatment of hypothyroidism is straightforward with thyroid hormone replacement, typically levothyroxine. The cardiovascular benefits of treatment can be dramatic. Blood pressure often normalizes, cholesterol improves, heart function improves. But treatment requires appropriate dosing and monitoring. The goal isn't just bringing TSH into the normal range, but optimizing thyroid hormone levels for cardiovascular protection. Some patients need higher doses or additional T3 supplementation to achieve optimal metabolic and cardiovascular function. Seasonal adjustments in thyroid medication might be necessary for some patients. Thyroid hormone absorption can be affected by dietary changes, supplements, and other medications. Winter's dietary patterns, higher vitamin and supplement use, changes in other medications, all can affect thyroid hormone levels. Regular monitoring, particularly during winter for patients with cardiovascular risk factors, ensures adequate replacement. The intersection of thyroid and cardiovascular health exemplifies the importance of considering metabolic function in cardiovascular risk assessment. Someone presenting with winter cardiac symptoms needs evaluation that extends beyond just cardiac testing. Comprehensive metabolic panels, including thyroid function, should be standard. For the many people with undiagnosed thyroid dysfunction, winter might be when symptoms become impossible to ignore, creating an opportunity for diagnosis and treatment that provides both immediate relief and long-term cardiovascular protection.